Hey there, I'm Sophia, and I'm going to walk you through how to inject Pregnyl under the skin or subcutaneously. One thing before you begin. Pregnyl can also be injected into the muscle or intramuscularly. So just be sure you know which method your healthcare provider has instructed you to follow. These instructions are broken up into 5 quick steps, which you can jump to at any time using the chapters below. Let's start by making sure you've got all your supplies ready to go. A vial of Pregnyl, also known as HCG. A vial of bacteriostatic water for diluting. A sterile syringe. A mixing needle, which may or may not arrive attached to the syringe. An injection needle, plus alcohol pads, sterile gauze, a sharps container, and a clean surface. You may get prescriptions or supplies that use cc or ml interchangeably. Don't worry. They're just different names for the same amount of volume. For example, 1 cc is equal to 1 ml. I'm going to share instructions on how to mix and inject 10,000 IUs today. But if you require a different dose, check with your healthcare provider on next steps. Now, go ahead and wash your hands really well with soap and water. Then you're on to preparing the area where you'll give yourself the injection. There are a few places where you can inject your medication under the skin. In the abdomen, just below or to the side of your belly button, or in the leg, in the upper outer area of your thigh. No matter which area you pick, try to avoid injecting yourself in the same exact spot each time to lower your risk of a skin reaction. And never inject into any area that's tender, red, bruised, or hard. For today, I'll show you how to inject in the abdomen since it's the most common spot. First, use an alcohol wipe to clean the skin about 2 inches around the injection area. Then, give it a couple of seconds to dry while you get your medication ready. Next, you'll mix the medication. You're going to mix the powdered Pregnyl with the diluent. To get started, remove the caps from both vials and wipe the tops of each with an alcohol swab. Unwrap the syringe. If there isn't a needle already attached, twist the mixing needle onto the syringe and remove the needle cap. Next, you'll draw air into the syringe, so pull back the plunger to the amount of diluent your healthcare provider has recommended, usually 1 cc or 1 ml. Place the vial on a flat surface and insert the needle through the rubber stopper and into the vial. Gently press the plunger all the way in, which pushes the air into the vial and makes it easier to withdraw. Then, without removing the needle, turn the vial upside down. Make sure the tip of the needle stays submerged in the solution as you slowly pull back the plunger to withdraw the recommended amount of diluent. When you're done, place the vial on a flat surface and withdraw the needle. Now slowly inject the 1 cc of diluent into the vial of powdered Pregnyl by inserting the needle through the rubber stopper and slowly pushing the plunger to inject the solution. With the syringe still inside the vial, gently swirl until the solution is dissolved. If the solution isn't clear or you see any particles floating around, don't use it and call your healthcare provider right away for next steps. Without removing the needle, turn the vial upside down. Make sure the tip of the needle stays submerged in the solution as you slowly pull back the plunger to withdraw your dose. Now you're ready to switch needles. First, remove the mixing needle, recap it, and twist off the needle and cap from the syringe. Toss the needle into the sharps container. Next, twist the injection needle onto the syringe and remove the cap. To get rid of any air bubbles, point the needle up and gently pull back on the plunger or tap or flick the syringe until the bubbles rise to the top. Then press the plunger slightly until a tiny droplet of medication appears at the tip of the needle. A droplet is a good thing. It means your medication is ready to go. Now you're ready for your injection, so let's do it. Hold the syringe in one hand and with the other hand, pinch a fold of skin around the injection area. Insert the entire needle straight into the skin at a 45 to 90 degree angle. Slowly push the plunger until you've injected all of the medication. Do a quick count of 1, 2, 3, and then let go of the skin you're pinching. Press down firmly on the injection area with a gauze pad and remove the needle. Nice work. Now, your final step is cleanup. If there's Pregnyl left in the vial, store it in the fridge for up to 60 days. Then go ahead and toss the used needle and syringe into the sharps container. And that's it. Thanks so much for watching today. Take care.